Alright, so this is going to be a taping technique for someone who has nerve entrapment or tarsal tunnel on the medial side of their ankle. We're going to try a couple things. So I'm going to have two small pieces of tape and one piece that is a little bit longer, probably around 10 inches, 10 to 12 inches at the most. Shorter pieces, probably around like 4 to 5 inches, maybe 6. So because she's getting symptoms that run down through her foot and create numbness into her big toe and some of her other toes, I'm going to try and create a little bit of a tug on the skin to try and lightly pull that nerve in this kind of back posterior direction. Not that I'm actually going to change the position of the nerve, but just that pull on the skin around it to try and take some pressure off of it. So I'm going to start off up above her medial malleolus and lay this right across the top of her shin or tibia. And then I'm going to pull the paper back on the tape. And no tension until I get a little bit closer to her tendons and muscles that are crossing the medial side of her ankle. And I'm going to put just a little bit of a pull to try and create a tug on the skin as I come back around to her Achilles. And then once I get to the other side of her Achilles tendon, I'm going to let off the tension and just lay this tape right across. And I'm going to do the same thing below her medial malleolus here, so another rip of the tape. I'll start off more on the top of her ankle / foot. And once again, I'll wrap down around, coming down across underneath her ankle. And then once I hit right above where her navicular or the arch of her foot begins, that's when I'll come around and I'll create a little bit of a light tug on the tape, maybe 50% tension, just trying to create a little bit of a pull on the skin. And then once I get to the other side of her Achilles, I'll take the stretch off and once again just lay it across. And then the last piece, I'm going to fold in half, create a tear in the middle. Now if I know that when she flexes her ankle, it's going to pull at that tendon, and when she's down, it's going to put a little bit of slack on it, I'm going to have her in a little bit more of a toe down position. And I'm going to put a little bit of a stretch in the middle. Go ahead and turn your leg out some. And I'm going to try and run this right over top. So a little bit of a stretch right around where that nerve is wrapping around the inside of her ankle. And I'm going to lay that tape on her skin. And then just no real tension, just running it up the inside of her calf. And on the other side, trying to curve it around so it comes right around the inside of her foot. And I could take it up along her arch like I did, or I could have wrapped it underneath her heel. Either direction is okay. This follows a little bit more of the track of the tendons that cross the inside of her ankle. And then a quick rub, and she's good to go.